Dr. Charles Blumer has a biology background. His original undergraduate degree is, well, he'll explain it, was science. And he then moved on to do a PhD in health statistics. So he's an epidemiologist. Charlie is very widely read and reads all kinds of things, economics and history, biology, and he has for many years taken a keen interest in everything to do with nutrition and also sustainability. So Charlie is going to offer a perspective. When I asked Charlie to talk, I asked him to talk about real food miles. So one of the overarching themes of this session with Sam, Charlie and the Ryan brothers is real food. So they're just bringing up Charlie's presentation now, and I will hand over to Charlie and he can explain who he is and give his talk.
Thank you, Liz. And it's a real pleasure to hear Sam describing his work. And I think being a true farmer is expressing a love of the land and a love of the animals and seeing that all are treated well and ethically. I'm an epidemiologist, now working as a public servant. My first training was in zoology, and I have a continuing interest in human ecology, the study of how people live in, use, and affect the environment. The views presented here are my own and have little relation to my work now. But I have worked on the epidemiology of chronic diseases, heart disease and diabetes in particular. Interesting to hear other speakers talking about their treatment of people with type 2 diabetes, gestational diabetes yesterday, polycystic ovarian disease, and autoimmune disease. And last not least, obesity. Decades ago, when I was involved in a large heart disease study, these others were rare conditions of interest to just a few curious researchers. But now they are everywhere. 1 in 4 people in the US have type 2 diabetes or are on the way. And so many people know someone affected. What is going on? I'm not going to answer this question directly today because the research questions have been looking in the wrong direction. But I'm going to offer one particular research article which explains so much. I'm going to traverse some research, some history, and some new perspectives on how our food environment has been transformed. I aim to suggest how we can reclaim a healthier way of living and life. So, to start. This research is now nearly 40 years old, initiated and carried out by Kerin Oday, one of Australia's preeminent nutrition researchers. Participants were middle-aged, overweight Indigenous people, and sounds like many of us, the middle-aged and overweight. They spent 7 weeks out in bush and being self-sufficient. The major metabolic abnormalities of type 2 diabetes were greatly improved or completely normalized, was a key finding from the research. I'm not suggesting we all need to go out bush, but for this conference, these are results to take note of. As a short aside, but related to the overall theme of the conference, on their Outback holidays, what is the traditional food that people eat? And as you can see in the image, It's damper. What is it about damper? Here's part of the answer. And I'll show a sack of flour that has been in our larder for years, a good 5 years plus, and it's still perfectly good to use. Where are we? Aren't we translating?
It's not working, is it?
Not working. We're just having a technical issue here.
You want to go forward?
Yes. There we go. Thank you. Flour, is it? Back in the 19th century, this is what the pioneers lived on for months. Here are some extracts from a how-to guide for the time. Flour should be packed in stout, double canvas sacks, well sewed, 100 pounds in each sack. Note the quantities and the time frames. It lasts for months. Vegetables, after having been dried in an oven, they become hard as rock and they last for years. The nutritional value of these vegetables now, from what we know about vitamins, of course, was seriously compromised. But lastly, and particularly for this talk, in this manual, they also state there is an agency for them in New York. This is one step, marking the beginnings of the food industry as we know it today, emphasizing the word industry. I noticed in Sam's talk his reference to a commodity. They're not producing a commodity now, they're producing food. As we talk about low carb today, shown in this figure are the two biggest sources of carbohydrate in Western society, sugar and wheat. Notice the size of the driver in the front end loader, a tiny little bit of orange, up high, and the huge pile of sugar. Shelf life isn't quite the right word, but the observation is, if you were to set aside 10 or 20 tons of sugar for 10 or 20 or even 50 years, storing it safely, it would still be sugar. The industries and the quantities are, to use the technical term, ginormous. Around the world each year, over 160 million tons of sugar are produced. Note again the language. Sugar is not a food, nor even a foodstuff. It is a product that is produced. Okay, we've seen the bulk transport of wheat and sugar. What about getting some food onto your plate? Shown here is Farmer George, an Australian mother's story invented to inform her child about where food comes from. Of course, as adults, we all know that milk comes from cows. No, it doesn't, Mummy. We get milk from the supermarket. There is a disconnect, and we shall come to that in the next slide. But it's worth commenting on a recent blog post from Farmer George, released for World Milk Day, arguing against the pitiful prices that farmers are receiving for their milk at the gate, while the big supermarkets sell milk for $1 a litre. Apparently, one of the lowest generic milk prices in the world. So here's some of the explanation. Originally in this diagram, to the left of the blue arrow, I had farmer, but this isn't right. Now it's food producers. Recall our agent in New York. This is the man who now rings up in the middle of winter and says, I need 5,000 kilos of strawberries for next month. Midwinter in North America. He is the person at the middle of this figure, which is shown for Europe. At the top, the farmers, about 2 million of them, food producers that is. At the bottom, 100 million shoppers on behalf of nearly 300 million consumers. But in between, bringing them together, there are just 85 buyers controlling the food industry. Add transporters, wholesalers, distributors. In Australia, Woolworths has 6 distribution centres for the whole country. Note also Woolworths as a transporter. They pick up from the gate, making it so easy for the large growers, and then distributing it to your door even. A standardised product, out of season, available all year, manufactured and high tech. I have 2 examples here to show you. This is a jar of tomato paste, and see the lid on it? It has a use by date, actually 2015. It's still usable, but the thing also is that it contains sugar. 10 teaspoons of sugar in this jar of ostensibly tomato paste. Imagine 10 teaspoons eating that down as you put it into your dinner. There is also, in relation to this figure on the right, an image from a magazine called Food Engineering Magazine. It informs consumers of a company's key message, the packaging, that is. Key message, values and priority. Noting though, that such a magazine should even exist, and that it is you, the consumer, who is being seduced into buying a food product. It is not food. If it is packaged, it is a product. And again, is there a world sugar crisis? For 2020, London sugar traders are forecasting a deficit of 8 million tonnes of sugar. See that the traders are in London. Last time I was in London, I didn't see any sugar cane growing in lanes of fields of Sussex. This is the face of international commodity trading. Shown in this picture is a large part of Australia's contribution to it, the Burdekin Valley in far north Queensland. And on either side of the river, you can see the cane fields, and in the distance, not so clearly, the township of Ayr. Connected to this, I would love to show you the pretty coral being replaced by dead and diseased coral. But I want instead to show you the big picture. And if I click on the transition, we can see now the Burdekin River flooding into the sea during the recent 2019 floods in Townsville and area. The mud and the sediment, the nutrients and the pesticides being washed out to sea. And in the top right of the picture, around the clouds, you can see the coral keys. I acknowledge the efforts of farmers to reduce the runoff, and this is increasingly being regulated. But at some point, we have to ask whether it is even proper to be growing cane next to the Great Barrier Reef when flood events like this occur. But these environmental problems are an integral part of industrial food production. Come on. Come on.
Big button.
Just magic touch.
Big button.
Recalling our agent in New York and the bow tie figure. Lots of figure growers, millions of consumers joined together by a handful of buyers, agents, whatever you want to call them. Who is using the power here? Some further reading is this book, Dustfalls of Empire, if you're interested. You will have heard of the Irish famine in the middle of the 19th century and the cause of many of our forebears being in this country or North America. The potatoes failed, yes, but plenty of grain was still being harvested in Ireland at that time. The grain, though, was owned and purchased by agents who transported it elsewhere so that the poor Irish were left starving. This is the real history of Ireland. There's no suggestion today of any such behaviour, but elsewhere, wherever people are denied access to land and cannot afford to buy it in its produced form, they will go without. And so here, I would like to emphasize the value of people on the land who grow food as food and not as a product, to which we shall come back. Oh, thank you. This is the crux of it, returning to sugar and looking back at human health. This is the key evidence I pointed to at the start, and putting research in inverted quotation marks. The actual article is a review of historical documents from the 1960s. And the background is, with higher rates of heart disease, an English researcher, John Yudkin, was finding in the 1950s that glucose levels were better predictors of blocked arteries than was cholesterol or hypertension. And the explanatory mechanism to go with it, such as you've been hearing yesterday. This mechanism is still lacking for cholesterol after all these years. But back in the 1950s, enter the Sugar Association, a Washington-based trade association. In the 1960s, they commissioned a review, hiring the best researchers that money could buy. The funding source was not revealed in the publications. And a key part of the review was the dismissal of inconvenient study results on a range of spurious reasoning. And instead, this review promoted the view that dietary cholesterol and saturated fat were the real cause of raised cholesterol levels and increased heart disease. A classic case of bait and switch. They dismiss one side of the argument against sugar, but then ignored them for your side. And the final recommendation was that diet heart disease studies in the future need only study serum cholesterol. Have they done well? 60 years later, heart disease is still a leading cause of death in Australia and around the world. With the promotion and government-sanctioned approval of low-fat food products, sugar is riding high. Here we talk a little bit about food miles, but I won't go into the details because I think you can appreciate now. From a few mega distribution centres, food is trucked thousands of kilometres around the country each year to Australians. But there is alternative now. Okay, we still have some transport problems in the outback, especially for remote communities. But note the branding on the truck. There is none. Recalling Kerin Oday's work from a follow-up report in the Medical Journal of Australia in 1991, metabolic disease is reversible. So that the next step has been taken. Rather than be at the mercy of big food operators and transporters, remote Indigenous communities have got together to take more control over their food supply by creating Outback Stores. Their mission statement in part reads, to improve the health of Indigenous people by improving access to nutritious, affordable food. Example of this in the stores is that sugar drinks, you know the ones, are kept at the back of the store, not by the checkouts. And they only come in 1 litre sizes. Bottled water for drinking is priced cheaper than the sugar drinks. So if you're poor without much money, you now have access to the better product that is not going to affect your health. A second alternative, farmers markets. And this is where you come in. We can cut out the food miles, but more critically, the bow tie. The buyers and agents, the wholesalers and distributors, they can't extract their 2 bobs worth, so that the farmer now gets a proper share of the pie. Organic fruit and veg is cheaper at the farmer's market than it is in the supermarket. Better for you, go for it. Meat, eggs and dairy were cheaper in the supermarket, but I think we can understand now why that is so, because it is industrially produced food. The other thing is that the food miles are reduced. Farmers' markets, 97% of produce are sourced from within 200 kilometres of Lismore, which for our international viewers is on the northern New South Wales coast. By contrast, the supermarket produce, 75% of it came from around Australia, not further specified. So you can imagine the food miles attached to that. In some sense, these comparisons are not so sensible to make because they're talking about different products. But as people always have some concern for cost, I want to emphasize that fresh fruit and vegetables can be bought cheaper than at the supermarket. Let's now hit the rubber in terms of real industrial agriculture. This shows the importation of soybean meal to Australia by year. And you can see since the 1980s, it's been going up gradually so that we're now importing, I think, about 1 million tonnes per year. Now, what's soybean used for? Well, it's used to feed chicken, particularly, and this is where it comes from. I know that you're looking at the combine harvesters, bright red, going across the field, and the scale of it. This is soy harvesting in Brazil. But on the left, look also at the rainforest being cleared. You can see along the edge, the trunks of pristine forest trees, 15 to 100 meters tall. But from the height of the picture, they're very small. And this again, to give you an impression of the scale of the operation. Soy is imported into Australia to feed industrially produced chicken. No wonder it's cheap. Third operation is farmer and shop directed. Rather than identify particular individuals or shops, apart from perhaps just referring to Sam, who's provided a golden example of how to do it, I buy fresh, very fresh, fruit and veg from a farmer's outlet about once a week. At my workplace also, another farmer visits once a week, supplying what he's grown and what is in season. My partner goes each month to a butcher in a real butcher's shop who sources organically grown meat from people like Sam. In both these places also, we regularly see the same known faces who have names and who know us as well. This is how it should be. And it is a privilege to be able to share this session with Sam and to have heard his talk on regenerative agriculture. Thank you.